I think healthcare is going to look very different over the next number of years. My sense is that we're really going through really a 40 or 50-year revolution, and sometimes you don't really realize you're in a revolution until you look back at it. You have to go back maybe 40 years to really understand the beginning of telemedicine. It really started out as the use of video conferencing over a distance, used to improve access to care. So if you live far away in a remote or rural area, you needed health care, you could use video conferencing, you could use medical devices like digital stethoscopes, handheld exam cameras, and a physician or other health professional could examine you over a distance. That rural access is still really a central part of what we do, but I think technology has evolved and telemedicine has evolved. So now it's not just about rural, but it's also about care in urban areas. It's not just about access, it's also about improving the quality and sustainability of our healthcare systems. In recent years, OTN has developed new applications. So a very exciting one for us is telehome care. And that's really the use of remote monitoring technology to support patients with chronic disease in their home. The key there, of course, is that it's really all about self-management. So we've paired the technology with nurse coaches, and these nurse coaches have been trained on how to work with patients with chronic disease, and most importantly, how to motivate those patients to change their lifestyle. The way they work with folks is they'll call them up and they'll say, what do you care about? What is it that you care about? And the patient will say things like, I really want to spend more time with my grandkids. Right? I don't have the energy and I want to be able to play with them. And the nurse will say, perfect. If you want to do that, here's the things that you need to do to achieve that. It definitely is a shift in the way that we need to think, because we've designed a whole healthcare system really to manage sick people. We're starting to obviously evolve beyond that, but we still have not fully embraced what you have to do in the community to actually keep people healthy and keep them away from the hospital. We've had a lot of great stories. One of my favorites is a patient with chronic lung disease, and the nurse came to his house to install the telehome care technology, and she walked in and all of his furniture was all against the wall, all around the outside of his living room. And the nurse said, why is your furniture all against the wall? And he said, that's so the paramedics can get in here. 6 months later, when she came back to pick up the equipment at the end of the program, all the furniture was back in the middle, right? And she said, why is it back? And of course he said, I don't have to call the paramedics anymore, right? So that's the sort of difference it makes when you can help people to really understand, organize, and self-manage their own care.